Hello, my name is Charles Ousley. I'm Director for Student Recruitment for the Harrison School of Pharmacy at Auburn University. One of the things that we need to consider about pharmacy as a profession is exactly what does a pharmacist do. A pharmacist is one of those healthcare practitioners who goes to school or who has gone to school for 4 years, and during that time he or she has prepared themselves to treat patients' disease states with medication. Pharmacy requires a licensure exam after graduation, and during that licensure exam it's referred to as the NAPLEX exam, in which the pharmacist takes immediately after graduation for the respective state or the states in which they're going to practice. One of the neat things about a Pharm D degree, which is what it's referred to from a vernacular standpoint, that stands for Doctor of Pharmacy degree, it prepares you for so many different things. First of all, as you look at pharmacy, it's one of the most trusted professions year in and year out by whatever national poll is conducted among the patients. And in addition, it is very flexible. It enables students to have a profession that is very balanced from a professional standpoint and from a personal standpoint. It is also currently, from an economic standpoint, very rewarding. And then in addition, there is much demand for pharmacist positions throughout the United States today. So what that means is once students complete their Pharm D degree, they're going to have a job. And that leads me to the areas in where they can practice. There's just so many different areas in which they can practice. With the Pharm D degree today, 60% of the students who graduate from our school and most schools go on to a practice in community pharmacy. And in community pharmacy, there's just many different settings within that as well. What you see there is the chain store practice, you see the independent practice, you see compounding pharmacies, you see subspecialty pharmacy practices such as nuclear pharmacy practices. So those are just 4 areas that we put into the community pharmacy practice setting. Then we see hospital pharmacy practice, where you can go into an institutional practice with many hospitals across the nation. That could lead to a clinical practice of pharmacy, where we see many of our students going into hematology, oncology, pediatric, psychiatric, infectious disease, are all different subspecialty areas of pharmacy. Typically these are students and now professionals who go into these subspecialty areas after having completed a postdoctoral residency. So that would be an additional 2 years that would be incurred after the 4-year Pharm D program. Then there is the academic practice of pharmacy, which with the new pharmacy schools that have been opening in the last several years is also a very attractive area of practice for pharmacists. And then in addition to that, you can build upon your Doctor of Pharmacy degree and go further into research if you would like to do that in the area of a PhD or a master's track. The coursework requirements for students entering into the Pharm D program, regardless of the schools today, is very varied. And that's where the advice I give the students is, look at the school or schools in which you're interested in applying and find out specifically their prerequisite requirements. As I mentioned, the Doctor of Pharmacy program is 4 years in length. That is preceded in most schools by a 2-year time period of prerequisite work, which, as you can imagine, would be heavy into the sciences, typically the chemistry and the biological sciences. Some schools, such as what we've done here at Auburn, and there's about 10 or 15 schools like us across the nation, have added the 3rd year requirement, meaning that it would take at least 3 years of undergraduate work to complete the prerequisites. And This is where these schools have added courses in the biological sciences, typically courses like immunology, genetics, biochemistry, and microbiology would be an example of the courses that students would be expected to take. And then there are other schools across the nation which do require the baccalaureate or the undergraduate degree. And as you would expect, that degree would typically be in a biomedical science, in a biology, or in a chemistry track. What the student needs to do is to ascertain exactly what are the elements for admission into each respective school. You know, from excuse me, from our perspective, what we look at are four things. The first thing would obviously be GPA, or grade point average. We're going to consider strictly those courses that we require as our prerequisite, and we're typically going to be looking at the average student admitted of a 3.3 to a 3.6 GPA in order to make that student competitive. Secondly is what we refer to as the Pharmacy College Admission Test, referred to as PCAT. This is a test that tests students over 5 subsections: verbal ability, biology, reading comprehension, quantitative analysis, and chemistry. In addition to that, it also requires 2 written essays for the student to complete. This test is graded on a percentile basis, and we're typically going to be looking at a 50th percentile or above to be competitive, but in order to be admitted, the average student is usually scoring in the 70th percentile. So that would be the second factor for admission. The third factor for admission would be those elements which we would glean from their application that most schools require be submitted through PharmCast, which is a centralized application service. On that application, what we're looking for is during the college years, what organizations, specifically more than what organizations, what leadership, responsibility activities has the student been engaged. Secondly, what volunteer work has the student undertaken. We would like to see that in patient care activities, but what I tell students is go with what they're passionate about relative to volunteer service, because there's very limited areas where they can seek volunteer work that are directly related to patient care activity. Thirdly, we want to know, have they job shadowed? If not job shadowing, we would like to see some technician work. Pharmacy is one of those careers where you can practice as a pharmacy technician prior to entering the Pharm D school, and this is very helpful once you are admitted, into a professional program. We're going to see an essay as to why they want to be a pharmacist. These are all important elements as we review their application in order to invite them for the fourth element that we review, and that's the interview itself. So we get hundreds and hundreds of applications that we review, and from those we glean GPA, PCAT, and application information, and then we invite a selected number of students each year for an all-day interview in which we're looking for such things as communication, leadership. We want to know, can they solve problems while thinking on their feet? We want to know if they're good at facilitation, meaning how well they can work in groups. We want to know something about their character. We're trying to ascertain, does this person enjoy people? Is this person caring? Is this person honest? These are all character traits which we think are important to the practicing pharmacist today. So with those 4 criteria then, schools will evaluate the student and admit them based upon their competitiveness with the other students who are applying that particular year.